Hi, I'm Ricardo Soares Magalhães. I'm the Professor of Zoonotic Disease Epidemiology and Biosecurity at the University of Queensland. I'm primarily based at the School of Vet Science within that university.
Hi, my name is Neil Vora. I'm a medical doctor. I work for Conservation International as its Senior Advisor for One Health, and I'm also the Executive Director of the Preventing Pandemics at the Soares Coalition. So what are your thoughts on how human health sector can learn more from the veterinary sector?
Look, I think from the veterinary education point of view, having these subjects addressed as part of the curricula is second nature, right? So, and I guess we perform veterinary medicine in many ways. One of them is for the protection of human health. For example, in food safety and all the content that we go through in the initial years of the degree, but also at the final years, to protect the food chain from these types of events. So I guess one way could be that the curriculum in the medical school approximates what we teach in terms of food safety. There's elements as well of advice to patients to understand the risk factors that are important to consider when a patient presents to you with a particular infection. I can give you the example that at the vet school we usually receive calls from farmers to give them advice on a particular infection that they acquired or a family member has acquired. So we're not equipped to provide that advice, but we can certainly say what the main risk factors may have been. And so I guess making that link between what the animal exposure can be in a setting and linking back to the management of the case, which is primarily in the medical space. So I think that bringing those two approaches together could happen as part of a modern curriculum of medicine.
Yeah, I entirely agree. I think that we do need to be thinking about how future doctors are being trained and educated, and bringing some of that veterinary perspective would be really important. And I've heard other people say this before, but the veterinary field is the ultimate generalist doctors. Human doctors are actually a specialist type of doctor, and then you can specialize further as a human doctor into neurosurgery or ophthalmology, or you can be a general practitioner. But veterinarians are the ultimate generalists because you all are dealing with many species of animals, not just one species. And so I think that's something for us also to think about more in how we educate future doctors.
There's also an historical perspective that I would like to highlight, which is before the advent of the veterinary schools in the 18th century, you only had medical schools, and veterinary schools are a spin-off of the necessity to control a disease called rinderpest. And so the different vet schools actually initiated with medical doctors teaching individuals to address these diseases, right? And obviously in the past 250 years, these two disciplines have diverged and have specialized into their niches. I think with the One Health sort of initiatives around the world, it's very clear that there is a need to approximate. We can't continue on this divergent pathway. There's a need in terms of the curriculum to come back in certain areas to this integrated sort of approach to health.
Yeah, absolutely. And it's increasingly clear that the way that many people, if not most people, will experience climate change is through the impacts on their health. And no matter who you are or where you live, everyone is now feeling the impacts of climate change. No one is immune from this crisis. And I think that's why there's been this growing climate and health movement. We're not seeing that as much happening with biodiversity in health or with other health threats that originate from nature. And I thought that COVID might have changed things. Unfortunately, we've not seen as much of a change despite the tragedy of COVID. But I think, again, we have a lot of work to do to make sure that future health professionals on the human side understand that our health as humans cannot be separated from animals and the environment.